What is a safe heart rate to aim for during exercise with PAH, and what danger signs should I watch for?
Like most things in our lives, it's hard to say that there's just, the answer is black or white. It really is dependent on the individual. So, one of the things when we think about heart rate is the heart rate is really an expression of, the exertion and the need of the body. So the heart rate increases to increase the output of the heart, to squeeze more blood more quickly, to be able to get that oxygenated blood to your muscles and your organs. And so as you exercise, we expect someone's heart rate to go up because the body requires more oxygen and the red blood cells carry that oxygen. And so, as the heart says, there are two things I can do. I can squeeze, sort of more strongly, or I can squeeze more quickly, or I can do both. And so, when someone's heart rate increases, it really is a sign that the body is in need of more oxygen. So, when we do our walk test or when someone exercises, that is absolutely the expectation. Now, the question is really what is an acceptable heart rate to achieve? And I think that that depends on the purpose of the exercise and who that person is. If you were an elite athlete, an appropriate heart rate could be up in the 160s, 170s for shorter periods of time. For somebody who has pulmonary arterial hypertension, we don't necessarily want someone to sustain tremendously elevated heart rates. So, this is where these exercise programs can be so beneficial because the individual who's helping to set it up will be considering how are you feeling when your heart rate is 90? How are you feeling when your heart rate is 105? Is your heart rate 125 and you feel okay and you're not short of breath and you're able to continue? So it really is dependent on the symptoms that someone may be experiencing along with that heart rate. One other really important thing when we talk about someone's heart rate is we know how well the heart sort of recovers after exercise, depending on how quickly someone's heart rate goes from maybe increased to back to their normal heart rate. We like to see that within 30 seconds to a minute that their heart rate is already coming down, indicating that the heart did what it needed for that time. And now that you've stopped, the heart rate has decreased. So, all of those are things that will be looked at when you go to one of these rehabilitation programs to be able to set the right amount of exercise or movement for you. The second part of that question is what danger signs should be watched for during cardiac rehab? And this is one of the things that I really love about the rehab facilities is that they are talking to you and asking you about how you feel. And if you tell them something that could be concerning, then they're going to slow you down. They're going to have you rest. They're going to talk to you about, hey, that may be a trigger to change what we're doing. But when I talk to my patients, I would say that if you're exercising and you have a symptom, and these can be very specific. If you have a symptom of dizziness or lightheadedness, if you feel like your heart is pounding out of your chest or you're having chest pain or discomfort, those would be times that I would say you should probably kind of rein it in or slow down or sit down because those may be indications that the body is really telling you I don't feel good enough to continue what we're doing. The hard part is sometimes those symptoms might be things like I feel tired or I feel fatigued or maybe I feel short of breath. And that amount of shortness of breath will play into is that something that you should slow down or is that something that we would be able to push through? And again, when we ask our patients to engage in these types of rehab programs, this allows for them to get a sense of is this safe for me? And at what level can I safely push harder?